We've come to meet Dr. William Loudon. He's a pediatric neurosurgeon and the scientific director of the CHOC Neuroscience Center for Research.
I am a neurosurgeon that focuses on operating on children. My interest in traditional Chinese medicine and acupuncture started many years ago. As I was a chief resident of neurosurgery, when they're in the operating room, I have 100% focus on them and can really use my skills. But what happens to them after that? A brain tumor patient, for example, after I operate on them and after they receive their chemotherapy and their radiation therapy, I'm really not actively involved in their care. And there are large gaps of time where there really is nobody taking care of these kids as far as the quality of life issues. The one that I kept coming back to was the concept of traditional Chinese medicine. My world very often is focusing on maybe a cubic centimeter for 3 or 4 hours at a time. I take care of the disease, the diseased organ, the diseased tissue, the congenital anomaly, but I don't take care of the patient. And I think that's a fatal error in our medical system right now. Traditional Chinese medicine, in contrast, is unable to not see the patient. Their entire philosophy is based on the dynamic equilibrium of the patient. So the disease that we focus on is simply an imbalance in their overall system. The two philosophies actually fit together perfectly. I was so convinced on this that I actually sought out Ruth to try and bring her skills into my practice.
There is no other hospital that has Chinese medicine mainstreamed the way Children's Hospital does. In the emergency room, in the neonatal intensive care unit, in the pediatric intensive care unit, any doctor at any time can go in and click a button and order Chinese medicine for their patient.